This video is going to be describing the work we've been doing at Lockside Medical Centre, which is my practice, using QI methods to try and reduce the number of incoming phone calls to the practice and the number of abandoned calls. A bit about the practice: we're in a suburb of Greater Manchester called Stalybridge. We've got a list size of 7,800 more or less, and we're a training practice. 5 partners who work various amounts of full and part-time, and our population is kind of mixed socio-economic status. We've got some affluent areas and some deprived areas.
So part of the QI project, we decided to measure the number of incoming calls, the number of abandoned calls, and because Monday was the busiest day, we decided to do it over the week and plot it on a run chart.
How we started the project involved quite a lot of teamwork at first. So we shared with everybody the data that we'd gathered related to the number of calls were coming in each week, and really I think what was happening is the clinicians were sympathising with the reception staff in terms of how often they had to pick the phone up and how difficult it was to do anything else in their day job apart from pick the phone up. And we also shared the number of people that were having to hang up because they couldn't get through, and that really struck people as being something which was not a great thing for patients to experience and could potentially be unsafe if somebody was quite unwell. So they were quite engaged with us wanting to reduce the calls, and could see that we weren't just doing it because we thought it was a good idea, but because it would make their lives easier too, and that really helped. We realised we needed a bit more information before we got started though, because we needed to know kind of the range of reasons why people would call the practice and how frequently those things happened, for us to know which would be the best interventions to test out. And the reception staff were great. They tally charted this for us. They had a chart by each phone, and when people rang, and they marked down what the reason for the call was, so we could see the proportion of calls for different reasons. And we only needed to do this for a week or two just to get that range. That gave us enough information. And then we shared that at our practice team meetings. We meet every fortnight with the clinicians and the non-clinicians together, so we could look at the information we'd gathered, and then people could come up with ideas about what they wanted to try differently.
The interventions that we tested out was to send text messages to patients to let them know that the test results that they'd had are back. We send text messages to inform patients that the sick notes and the referrals are ready at reception desk. We're encouraging more people on patient access so that they can request their medication straight through into their medical records, and also send messages into GPs and get response through patient access.
One of our early successes was how much we managed to prevent the callback situation. So once staff answering the phone became aware that they were generating their own work or work for their colleagues the following day, they found an alternative way of sorting the problem out rather than asking somebody to call them back. So they collected a list where they would phone other people back when they knew the answer, or we generated a system where we could text people the answer to their query, and that was really good. We almost eliminated those altogether within kind of a few weeks to months of the project, which was great. Another variable, it was a success, and it still is a success, but we're still working on it, is the texting patients' results. And the reason I call it a success, because it was a really great example of teamwork. We needed the whole team to work out how best to do this in a safe way, because there's a lot of nervousness around texting patients' results in case things go wrong in that system, or simple things like checking mobile phone numbers, or if we have teenagers registered who might be coming in their own right and yet the number we have for them is still a parent's number. So that was quite a good success for teamwork. Another success was how much we managed to reduce the number of abandoned calls. Probably more in the long term, that's had more impact than even on the number of incoming calls, because workload continues to escalate. But we have made a difference to the number of incoming calls, or we did do certainly for the first couple of years of the project, but we're now re-kicking it off again because of new challenges. But we definitely reduced the number of abandoned calls from a median of about 300 a week to more like kind of 50, 60 per week of people who still might need to hang up because they can't get through. So still work to be done, but certainly a success.
So the challenges that we did face, that the CCG stopped pharmacists from requesting medication for patients, which meant that patients were ringing up to the surgery to request their own medication, and that increased the weekly calls by about 300. So we get new trainees every 6 to 12 months, and it's a challenge for them to get used to texting results to patients, so which means that they're asking patients to ring back to get the results.
The project has been a really good experience for practicing and learning more about the QI tools and techniques, particularly run charts. So because the number of incoming calls each week is a variable bit of data, so it flips around from one week to the next according to kind of case mix and weather, we needed to know how to interpret a run chart, how to use the median to spot if we'd made a difference. We learnt a lot about Pareto charts, so when we did our data gathering about the reasons people phone the practice, and we could use a Pareto chart to order them in terms of the most common and the least, so that we could focus our efforts. So that was a really good tool to practice and to learn from. But I think probably the greatest learning has been about the engagement part of QI and how important it is. So you find, as we found as we ran the project, that people would spot difficulties or things that weren't working well. And that could have been that they were grumbling about it or they didn't want to do the project, but because they were engaged and they knew the reasons and they're being kept on board, in fact that was a very useful thing. They were spotting things that we needed to sort out if it was going to be successful. So we needed that engagement and people spotting difficulties so that we could try and make things work. Some of the difficulties we faced through the project have been related to context factors within QI, which we know are really important to make something successful, and sometimes are out with your control. And some of this has been about software. They've changed their systems and we can't get the data. That's hard. Another context factor we've encountered, which makes things challenging, is people seem quite reticent to go on online access to get their prescriptions, and this would save so many phone calls for us. We had some success, so we've moved from people about 1 to 2% of patients requesting their repeat prescriptions online, and we now have about 11% request them online, which is a great success, but that's still 80-odd% who don't. You find with any QI project you often have to revisit data again, and that's what we've done. So in the last month we've been regathering the data about the reasons people phone the practice. And because QI is a continuous cycle and you've always got challenges, that's a useful exercise to do. We discovered that fewer people were doing the things that they really didn't need to phone for. Now we're keeping people informed about the progress of their prescription, but more people are phoning for appointments and prescriptions, so we need to use that information to tackle that area. We still have a bit of a challenge with people phoning to check things, and we've got a new piece of software to help us with that so that people can be told more readily. I think it's important for practices to recognise there are things that they can do to make their own working lives better, and I can promote using QI approach for that, definitely. If anyone needed to know more information about how to use some of the tools that we described, they're all available on the RCGP website on the quick guides.